Hi, my name is Crystal McDaniel, and today we're going to be going through 3 pieces of equipment that I can use with my client. Her name is Angie. She's a 36-month-old and she's diagnosed with cerebral palsy spastic diplegia. Her lower extremities are more involved than her upper extremities. She uses adapted stroller for functional mobility to get throughout the community. She does bunny hop on the mats in the clinic and at home, and she is able to sit upright with minimal support. So I'm going to be showing you 3 devices or pieces of equipment that we're going to go through and talk about their safety while using them. But in her case study, she is not diagnosed with any seizure disorders, so these swings will be appropriate and safe for her to use. Okay, so for one of the first activities for Angie, since she does enjoy hopping, is going to be the trampoline. So for safety purposes, we do want to make sure that there's a crash pad nearby and we have plenty of mats covering the area. Also, if you can put it in a corner somewhere safe, that's good. For this one, we're going to have the one with the bars so that Angie can go ahead and hold on to, and I'm also going to be standing nearby so that she can grab my hand or I can provide support if she does need that. But when we are done using this, just to go ahead, keep it in that corner or go ahead and flip it over just in case another kiddo runs in. We definitely don't want them to injure themselves. So taking all the safety precautions here. This is also good motivation for her to kind of get the strengthen her lower extremity, and also since she does have issues with her trunk, just to go ahead and strengthen her trunk control there. So what we're going to do here is, this is Angie. This is going to be her legs and her arms right here. So we have the trampoline here and the bars here, and it's go ahead and propped up in the corner. So what we're going to do is just go ahead and we're going to guide her on there. So have her place her hand onto the bar or on my hand, and I'll be guarding with all of our mats around, and we'll have Angie step up 1 foot, and then she has her arms placed here, and we're going to go ahead and get that other one. And then while she's holding on, I can be stabilizing in the back, or if she wants my hand, or she can try and jump by herself. We can go 5 little monkeys jumping on the bed. One fell off and bumped his head. Mama called the doctor and the doctor said, no more monkeys jumping on the bed. Okay, good job, Angie. So now we're gonna go ahead and get off. So step off. So still holding on, and I can use my hand for support if she does need it. So go ahead and step down with one leg. Okay, other leg. Bringing that leg down until she's safely off, and then I can go ahead and turn the trampoline over or move it into the corner just to make sure for those safety guidelines. And once again, this is definitely just helping strengthen her lower extremities and to work on her trunk control. But yeah, that would be our first one, and on to our next. Okay, so now for our second one that we're going to be doing the frog swing with Miss Angie right here. So once again, these are her arms. This is the front of her body, and then we have her legs down here. But since we are going to be using a swing, it is important to follow proper body mechanics. So when putting the swing up, you do want to make sure that you're using your legs to lift and definitely avoiding using your back there. Also along that, making sure that your back is nice and straight. You're going to use a step stool or ladder if you can't reach. I'm pretty tall, so I'm lucky with that. And then also just to make sure that you support the heavy swings from the bottom prior to taking them off. So some of the heavier ones like the platform swings, you're definitely going to want to pick that up prior because it is such a heavy swing. Some of the parts here are going to be the steel eye bolt that's at the very top of our swing. Also, we're going to make sure that we want to attach our safety rotation device, since this is going to be a swing that is going to be moving a lot, and we do have the bungee for like the bouncing. We're definitely going to want to include that. We also do have the height adjuster. We're going to make sure that we use it to adjust it to the child's height. So Miss Angie here, she is 3 years old around there. We're going to match it up with around her knees so that it's safe for her. And then also making sure that the carabiner is upright and that it's completely closed, again for safety purposes, because we don't want that coming off. Another thing too, we're going to want to apply enough mats around the area to make sure that everything is completely covered. Since we are on a swing, we do want to make sure that she's safe at all times. So the mats will definitely be helping with that, and I will be on guard too, just to help. But this is an appropriate swing because it's for ages 3 and older, and since she is 3, this is perfect for her, and she is motivated by the hopping and the bouncing. So this will be a good engagement. So we're going to go ahead and instruct Angie to get in here. So as she gets close, she's walking up. Okay, Angie, turn around. So we have her turn. So now we have face forward right here. And then Angie,
one arm, so hold on. We're gonna get into swing. So one arm here, and then we're gonna go ahead and get that other arm. So now she has both arms and holding on. Okay, bottom down. So now that she's sitting, has her legs here, and we'll go ahead and we'll swing for a period of time. But this is good for her because this will definitely help increase that core strength. Since she does have a little bit of a declined core strength, and also since she does have the upper extremity strength, this will definitely help so that she can hold on. So this is also good for the proprioception and a good motivator for her since she does like the bouncing and the input from that. But this will definitely be helping with that core strength for her. So good job, Angie. And then once we're all done with that, to get out, we're gonna have, okay, Angie, hold on. So holding on here with both arms. So one arm, two arm. And the next thing we're gonna do is we're gonna instruct her to say body out so that her head's slowly starting to come out. And then we're gonna say bottom out. So then she's safely off and down. And then once Angie's done with that, also what we're gonna be doing is we're gonna go ahead and we're gonna take the device down. Just in case any other kiddos do coming in, we do wanna watch out for safety issues. So if they come in and there's no therapist with them, we don't want them hopping on, or if there's any seizure precautions or anything like that that we need to be aware of. Just to get it down and then move it out of the way and have it ready for the next therapist setup. But okay, now we're gonna go on to our third intervention.
Okay, so now we're on to our third piece of equipment that we're gonna go through with Angie. So far we have done and incorporated two different pieces of equipment that do have vestibular involved with it. So we do wanna make sure that we're watching out for signs of indigestion, such as if they start sweating or if they turn pale or any of those physical signs, especially if they are a new patient. You always also want to make sure with the swing that you're moving in one linear motion first, and that it's just a single plane of motion until we actually get to know the client and know that they don't have any indigestion or anything that may occur, because that could happen hours later. And like I said, don't put them on the swing if there's any seizure precautions or if it's not monitored by any medication or anything like that. So for my next activity for Angie, since she does need help sitting in upright position, I did want to have something to kind of help that. So my next activity is going to be using this wedge. This is going to be the higher side right here, and this is going to be the lower side. So we're doing this because the other two were like vestibular and proprioceptive, just to do something a little bit different. I did want to pick this more stationary item just in case it did get Angie any like riled up or any indigestion or anything like that, just to avoid and make a calm activity. So we're going to be using the wedge here today. So what we're going to be doing is I'm going to have her sit on the edge of the wedge, this side that's up a little bit higher, just to kind of engage more of an anterior pelvic tilt, or also that neutral position, just to kind of help, like I said, with like the trunk and posture control. So within this, as this is Angie, once again, this is her two arms, and we got her two legs down here. So what I'm going to be doing just to kind of work on that trunk control is I'm going to be placing her over here on the wedge, and I'm going to be sitting around for support, and we'll have mats and everything like that surrounding her just to make sure that we have the optimal amount of safety. And another way just to kind of help give a little bit more resistance is going to be if you have kind of like a Dyson mat or anything like that, if we just simply place it on the wedge itself, so that way it'll cause a little bit more traction if she does, since she does need a little bit more support. This might help her from slipping backwards. So we're gonna go ahead and place that there, or you don't have to if she doesn't seem to be needing it. So over here, so like I said, we're gonna be putting her over here on the wedge and having her reach in different directions with me on close guard, and like I said, having the mats for safety around. So then that way it'll help kind of engage a little bit more of that trunk, just to get some more muscle strength built up. So we're gonna go ahead and have Angie here. So, okay, Angie, we're gonna have a seat. So we're gonna walk, walk, walk. Okay, turn around. And then from here, I'm gonna instruct her to slowly lower herself. So slowly lower. And what we're gonna do is use her arms just for kind of support. So go ahead, arm here. So she'll grab with her arm, and then go ahead and sit down. Good job, Angie. Okay, so now that we're sitting here, I'm gonna have her kind of reach for different items. So if she seems to be interested in any Beanie Babies or balls, kind of whatever she seems into at the moment, just since she is only 36 months, just to kind of keep her engaged so we can kind of have a bunch of different things around.
So I'll have her kind of reach to the side, reach forward, reach to the other side, just to, like I said, work that trunk a little bit more. And then once we've wrapped up the activity, okay, good job, Angie. We're gonna go ahead and stand up. And then from here, just guide her to stand up so she can push off with her hands and off. So push one arm, other arm, and then we're standing. And then from here, we do just want to make sure that we put away all the equipment. So go ahead and just fold up the Dyson mat if you did end up using it and putting it away in a safe location. And then go ahead and removing the wedge so we can put it upright. Just so that no one runs into it, or put it in its storage place wherever necessary. And this once again, just to create that neutral anterior pelvic tilt there, and just making sure that it's helping engage her core. But those are all the equipments that we do for little Miss Angie. Thanks for watching.